Thank you all for joining our fifth session of the day. We will begin in just a few moments. On behalf of the American Heart Association, I would like to welcome you to our fifth session, Midwife and Doula Care Models in Postpartum Care. This session, we will highlight midwife and doula-led approaches to supporting mothers during the postpartum period with a focus on how these care models address patient needs beyond the clinical setting. Throughout this session, you will have the opportunity to submit text questions for our speakers using the Q&A feature on your control panel. You may send in your questions at any time, and we will review the questions during our Q&A portion at the end of the presentation as time allows. To access live closed captions, please click on the closed caption button found on your screen. All sessions will be recorded and available in the coming weeks on our website. The recommendations and opinions presented by our guest speakers may not represent the official position of the American Heart Association. The materials are for educational purposes only and do not constitute an endorsement or instruction by the Heart Association. The American Heart Association does not endorse any product or device. And it is now my pleasure to welcome our three speakers for this session, Dr. Emily McGahey, Madeline LeBlanc, and Ali Quintos. Dr. Emily McGahey is the clinical director and practices full scope as a midwife at the Midwife Center in Pittsburgh, Pennsylvania. Madeline is a registered nurse, international board certified lactation consultant, and the founder and executive director of Mary's Hands Network in Louisiana. And lastly, we have Ali. She is a founding member of Community Well, a holistic family support center in San Francisco, California. She's a co-founder of SisterWeb and currently serves as their co-executive director. As a reminder, full speaker bios can be found in the event lobby. Now, Dr. McGahey, the floor is yours.
Thank you so much. I am so honored to be here to talk with everybody, and I'm so grateful for the work of the American Heart Association, and I have been lucky to be working with them since 2022. I was on that original writing group, and I've just been so excited to see how the work has grown and developed over time. And I'm coming to talk to you in the capacity of what I do every day. So I am a midwife. I'm here in Pittsburgh, Pennsylvania, and I work at a freestanding birth center. And many people are not aware or knowledgeable about what birth centers are. And so it's going to do a little bit about that and let everybody know that we exist. There's around 400 freestanding birth centers in the country, and we are home-like care facilities for childbirth where care is provided in the midwifery and wellness model of care. We are freestanding. We are not in a hospital. We are not a hospital. We don't have surgery units, anesthesia, those kinds of things. We are, however, integrated into the healthcare system. So we have access to our colleagues for a referral for maternal fetal medicine for clients who risk out of our care. And that is how birth center care is safe. And we are guided by the principles of prevention, sensitivity, safety, appropriate medical intervention, and cost effectiveness. And I think most people have an idea that midwifery has been around forever. Women supporting women, people supporting people giving birth is a tradition that goes till the beginning of time. And we look to incorporate that into our current system and how we provide community and care for people. And of course, most of my midwife colleagues do care in hospital settings. Um, and the model can be done anywhere, but this is the exclusive one where we fully function in midwifery care. And we respect and facilitate a birthing person's rights to make informed choices about their health care and their baby's health based on their own individual values and beliefs. And we are really family-centered, person-centered, and we bring in families as they define it, and they're welcome to participate in the pregnancy, birth, and of course, the postpartum period. And care and birth centers, what we do. So we do all birth centers care for low risk people for uncomplicated pregnancies throughout birth here in our birth centers, and through their postpartum period. And many birth centers do newborn care. Of course, we do it initially at the delivery, but we also some take care of babies all the way up through 28 days. And many birth centers also do full comprehensive reproductive health care across the lifespan, which I think is really, we've heard that like we want to decrease those gaps, those times when folks are not receiving care. And birth centers are an excellent model of that because we can provide full scope primary gynecologic care throughout their lifespan. So folks come to us for their birth, people come through us through all their pregnancies, and then they continue with us through their reproductive lifespan. And that really creates a great continuity of care where we really know our clients and have an ability to know their risks and what happens and know them as people and build a lot of trust around um, them speaking to us and telling us if things don't feel right and knowing that we'll listen. And we do all these other things as well. Um, but I'm just going to focus mostly on the postpartum. And I adopted this from a beautiful article. And I think it's really important that to understand that the midwifery model is a wellness model. We wrap around, we envision people as uh, whole people, right? It's not just the pregnancy and birth. So we see people much more frequently in the postpartum period. We may or may not include home visits for that, but much more now we're seeing our rest of our colleagues in this space adopt visits earlier than that 6-week visit. That's pretty standard for most midwives, including phone calls and checkups and in person, and that we care for both the mom and the baby, including lactation support. It's really that continuity of personalized care that we know the people, each person is different, may need and require different things for us as care providers. And we also do a lot of planning and preparation for postpartum. We talk about it. We talk about who your supports are going to be, who's going to be around you, who's going to feed you, how are we going to navigate back to work, all of those things, which again, I think promotes health and focus on postpartum rest and ensuring that people have access to maternity leave, support, and are able to care for themselves and their babies. And I'm going to go quick because my time's almost up. But at our birth center, I just want to emphasize how many people we have who touch our folks during their postpartum period. Of course, at my birth center, we have midwives and nurse practitioners who care for our people. Our nurses provide tons of support initially postpartum, take phone calls, do a lot of lactation support. We have actual lactation consultants who see clients for visits. We have our doula colleagues who come in, provide wonderful services. We have a community health worker here at the birth center. We ourselves have an integrated behavioral health and wellness. So for postpartum issues, they come up or during their pregnancy. Of course, we have our consulting physicians along the wide array of specialties, right? Cardiovascular colleagues, nephrology, MFM, all of those who might need, our clients might need follow-up from, and of course, our primary care providers. And then one thing that's unique for our birth center is we do have support groups. And we have had just wonderful, amazing support groups, postpartum support groups. And so just been thriving for so many years where folks with up to year-old babies come and the groups change and but we have babies here all the time. They just finished their big yearly Mother's Day celebration here today and it was fun to see all these folks here um, creating community and creating health. And this is just some pictures of our birth center and all the wonderful people that we take care of. So birth centers play an important role in here, and we'd love to see more birth centers and midwives uh, are in our country. So thanks for having me.
Thank you so much, Dr. McGahee, for highlighting your birth center and all the amazing work that you do every day. As a reminder to our audience, please send in those questions at any time. We will review the questions during the Q&A portion at the end of this session as time allows. But it is now my pleasure to welcome our next speaker for this session, Madeline LeBlanc. Madeline, the floor is yours.
Thank you, Anna. I appreciate it. I'm sorry. Yes, thank you, thank you, thank you. Hello, everyone. My name is Madeline LeBlanc, and I am the founder and current executive director of Mary's Hands Network. Mary's Hands Network is a community-based doula program here in Louisiana, and we are rapidly expanding because the work is needed and the community wants it as well as needs it. So I want to talk to you guys about how, as doulas and in our doula program, how we are helping to close that postpartum gap that so many moms face in what we like to call the fourth trimester. So after mom has delivered, that what happens next space. We know that the emergency of birth doesn't necessarily stop when the mom is discharged. In fact, the majority of pregnancy related deaths actually occur within a week to 1 year after birth. And the number one cause of that morbidity and mortality is usually going to be an underlying mental health condition. And over 80% of those deaths are considered preventable. And that's where doula care, specifically the community-based doula care, can really make a tremendous difference. For moms here in Louisiana, the trouble is especially difficult if you identify as a Black woman or a minority or Spanish or non-English speaker. If you are a Black woman in Louisiana, you are 3 to 4 times more likely to face the sickness, the morbidity, or mortality. There are many contributing factors to that, one of the greatest being the systemic racism of our system that was built entirely against our Black sisters, especially here in Louisiana, where less than 50 years ago, we still had Black and white separated hospitals. So here the problem is tremendous, whereas in other states, it's going to be different minority groups are going to face the brunt of that. But it's very important that we as a community are able to not only connect and touch, but are able to witness and hold space for those mothers, for those families, so that they can get the help they need. 1 in 5, so 20% of people who are giving birth are going to face either a perinatal mood or anxiety disorder. That is so common that 50 to 70% of those, however, go completely undiagnosed. A lot of that is going to have to do with the moms not going to their visits, not seeing a provider until that 6 week time, or they might not want to talk about it. There might be some cultural pieces, there might be some shame around it. So a lot of that goes undetected. And the way that we could easily intervene and detect would be by having a conversation with that client, by having a moment with them where we can ask them, how are you doing? How are things going? How are you feeling? What are you thinking about? So, our Latina, especially, and our Black mothers here in Louisiana are also twice as likely to face perinatal mood and anxiety disorders compared to their non-Black, their non-minority, and white sisters. So we decided to build a network to fix this. So we have a doula training program that trains community members to be ICEA, which is International Childbirth Education Association, certified birth doulas. So we have a standard training that covers everything from pregnancy, labor, and birth to the postpartum period. We do a little newborn care, we do some breastfeeding education, but we do a lot of education on recognizing warning signs and what to do when your client shows those warning signs of postpartum mental health, depression, or anxiety, or some of those cardiovascular issues like elevated blood pressure, heart rate, diseases like preeclampsia. So, what we did is we built a network of doulas, of volunteer community members who are assigned as a team, so two doulas to one mom, which means that every client that registers for our services immediately gets a community of two different members of her family, of two different members of her zip code that are going to care about her and are going to be there to make a difference, to assess, and validate what's happening. That creates a continuity of care that is not a luxury, it's the mechanism. It's how we're actually providing the care. Since we started in 2023, we have trained 254 doulas across 15 cohorts. We have supported more than 450 families, and right now we have 155 actively serving doulas in the state of Louisiana who are working with Mary's Hands Network clients today. That's across 5 of the 9 regions. This is a replicatable model and something that if you're interested in potentially bringing to your communities, I would love for you to reach out so that we can talk about how we could bring this to your space because it works. There are 4 different main touch points that we have with our clients. And this is where we can really make a difference. The first one is at 72 hours postpartum. We go through the Edinburgh postnatal depression scale. We get mom's baseline symptoms, how she's feeling, so that when we have that second postpartum visit within that first 2 weeks, we can check and we can assess how mom is doing from that baseline to now. Then we assess mom again at 8 weeks for another in-person visit. And again, we're doing that postnatal depression scale. And then finally, after 8 weeks, we move our clients to our administrative team and they follow up with the clients at 3, 6, 9, and 12 months. This extra set of eyes is there to watch for elevated blood pressure and preeclampsia, stroke signs, wound infection, but also the emotional warning signs, rage, instability in your mood. These are things that when we notice them, a doula can escalate that to a provider. And I want to finish with just our outcomes overall over the last 3 years. What we have seen is with doula services, doula care, we see more than half of the C-sections. So our C-section rate is 17.5% compared to the state's 36. We're seeing less preterm birth. We're seeing less low birth weight infants, and we're seeing sooner breastfeeding initiation, all of which are associated with improved maternal morbidity and mortality. So thank you guys. That was me.
Thank you so much, Madeline. That was so amazing. And thank you for highlighting your doula program and how you're successfully working towards to close that postpartum gap. It is now my pleasure to welcome our last, but certainly not least, speaker for this session, Allie Quentos. Allie, I'll pass it off to you.
Thank you so much. And thank you for having me. Really proud to be on this panel and grateful for the opportunity. So I'm also going to be talking about community doula care from a slightly different angle as our Louisiana, we call all community doulas across the country our cousins. So our cousins in Louisiana doing things a little bit differently in San Francisco, California. So this is really an opportunity for us to showcase the work that SisterWeb is doing and specifically how we're part of a greater fabric of providers together with our clinician cousins, CHWs, a lot of the roles that people have mentioned today, we really consider ourselves part of the web, serving the families together. As Madeline pointed out, in her state, in California, we're not doing much better. And it is a shameful and we believe preventable disparity that has its roots in the history of racism and the persistent structural and systemic racism that our families are encountering. So you can see, while other groups, we've been making progress along other racial and ethnic groups. For Black families, the disparities are actually getting worse across the US. And here, just a quick snapshot of our data in California. Really encourage people to use Peristats on the March of Dimes website. Very grateful for the opportunity because knowledge is power. So if we know what is happening with our community, then we can actually address it. So the importance of culturally congruent care. We at Sister Web really believe that while all people are deserving of support and respectful care and doula care, we really need to hone in on the families and the individuals that are most targeted by structural racism and have shown that through the poor outcomes, like Black families in San Francisco. So you can see here, this beautiful photo is one of our closing ceremonies. It is tradition rooted in the Afro diaspora across the globe, and a moment of pause and nurturing and holding moms in the postpartum, pouring love and support into them. And so, along with a lot of the strategies that we also use, like monitoring and pressure cuffs and postpartum mood screenings, we are also deeply, deeply committed to uplifting ancestral wisdom and using the traditions and songs. And the picture speaks 1,000 words. So we routinely have our clients speaking up about, for some people, this being the first moment that they experience this type of nurturing care and really felt held, seen, respected, supported, loved, and knowing that their own health and well-being matters just as much as their baby. The role of community doulas and postpartum doulas. We at Sister Web provide this wraparound comprehensive support that in most cases goes much, much, much above and beyond what the private doula model has. Our doulas are having weekly touch points with the clients. They are that who do you call in the middle of the night person, right? So it's the non-clinical, emotional, physical, educational support. We are also committed to economic justice. And so we do have an employment model where our doulas have a caseload. They're able to support their own families. All of our doulas are peer community members, and therefore many of them have children. About half of our doulas are also former Sister Web clients. And we really believe that by addressing the extended postpartum care, really going above and beyond in that postpartum time, making sure no one slips through the cracks, assessment and education, prenatally, making sure everyone knows those warning signs, and then laying eyes on people in the postpartum, and that readmittance support that Monet told the story this morning of her story. And our doulas are literally there to prevent that from happening. In the ecosystem of care, you can see we align ourselves with a lot of the clinical counterparts, but doulas have that really patient-centered goal. I love this photo, our doula Shanae. So when you think about what does that comprehensive care look like, sound like, feel like, you can see in our client's face that she knows she has somebody to call in the middle of the night who won't judge her, who will give her that solid advice, reassure her when everything is looking good, and urge her to go and get care and support when she needs it. We've also implemented enhanced care management. So that, again, is another member of our team who addresses things like housing insecurity and other social services that are needed. And then we've been able to roll out together with our partners at UCSF, again, the blood pressure cuff education, passing out blood pressure cuffs to our families, and engaging families in group education through home visiting, and also just, again, bringing people together, reviewing repetition on in a holistic way that goes beyond just picking up a pamphlet at your doctor's office, but really getting in the group, having face-to-face time. We have found that to be critical. And this beautiful, beautiful initiative that we are doing together with some community partners in the city, our Sister Web walks. These are getting our families and clients out into green spaces and walking, engaging their bodies, and really bringing people together from preconception, intrapartum, prenatal, and also our postpartum mamas, everyone together in the community out walking. And I'll close by saying that if I had my elevator pitch, if somebody says, what is the key? It is relationship. It is having somebody who looks like you, understands the specific challenges that you are facing in your perinatal journey, who is that trusted companion that you can go to and call. And so having a community doula as a bridge between clients, families, and their providers is critical. And we're so grateful to be able to do this work. Thank you.
Thank you so much, Allie, for highlighting Sister Web and all of the amazing work that you do every day. And thank you again to all of our speakers for an amazing presentation. While we wait for some questions to come in the Q&A, I was wondering, and I think this could be applicable to all three of you, but if a larger healthcare system wanted to adopt any of your programs, what is the one non-negotiable element that they must include to ensure that the program's integrity really isn't lost at that large scale?
Oh, I think Allie and I will have the same answer to this, which is that it has to be based in the community it serves. So if you want to have a successful program, our programs work because it's community members serving community members. So they reflect the culture of that area and that community. So respectful care, recognizing everyone's differences, and doing that by committing and collaborating to work with the community that you're in. That's what I would say.
I second that and appreciate it. My answer is a little bit different. I think for us, we're and I'll say we're pretty unapologetic about this, is that we are motivated by deep systemic and structural change. So we are not interested in being a band-aid to a system that is set up to fail Black families and Black community members. We are really interested in including policies, protocols, and getting leadership involved if it is a healthcare system, which we are consulting with several larger healthcare systems in the Bay Area. And we make sure that the leadership is at the table and that they're actually acknowledging the true root cause of the problem and willing to roll their sleeves up and change it. Then we'll bring the whole community and roll our sleeves up and join. But without that commitment to structural change, we will say no.
Thank you so much, Allie and Madeline, for answering that question. We do have one question that just came in from the chat, talking about preventing practitioners' burnout. How do you all make sure that you can prevent burnout within your programs?
So we have limitations on our doulas for how long they can serve a client for a certain period of time, how many births they can attend over a certain period of time. So we set those practice limitations so that we're trying to prevent burnout, but also it's very important that you feed into your network. So in addition to doing continuing education, we do continuing support. We offer debriefing. And then we really rely on the network mentorship so that our doulas are supporting our clients, but our doulas are also supporting each other. So they're working together to be able to handhold, decompress, etc. But the biggest thing about burnout is when you start feeling it, to recognize it so that you can do something about it.
I was waiting for Emily, but
I
I'll
mean,
jump in real.
I mean, I think it's, you know, this kind of work is really difficult. I think I'm probably coming at it in a different way for as a midwife, but like it's same things, right? We have to make sure people have work-life balance, take care of themselves, take care of their mental health, their bodies, their souls, making sure that they have time away from the work to be human beings, because that's we're all here to be human beings, and that's how we connect with the people, is to be people. And so, yeah, I think that's been the goal of our birth center, is to try to make sure that people like their work here, continue to like the work that they're doing.
Absolutely. All of those things, Sister Webb. Ditto on mental health consultation, ongoing mentorship. We also have found that for our staff and our community, that economic component is huge. And so we do offer a really decent living wage in the city. We cover health benefits 100% for staff. We offer 2 weeks of paid rest every year, a week in the summer, a week in the winter. And so those practices for our families that are single household, single income households with kids, to be a birth worker, besides all of the additional support, they have to be able to stay living in the city and juggling multiple jobs while being on call for birth is very, very challenging.
Thank you so much to our wonderful speakers today. We are fortunately at time. We just want to thank Allie, Madeline, and Dr. McGahey, and thank you to our audience for your participation and your questions. Coming up next, we have our last session of the day at 12:30 p.m. Central. We have a session titled Strengthening Community-Based Efforts in Postpartum Care. This session is actually a panel session. So if you're able to attend, we would love to have you. And to access this session, we have posted a link to join directly in the chat. Thank you all so very much for attending today's session, and we will see you shortly.